Every year, thousands of people are blindsided by one of the deadliest diseases on the planet, pancreatic cancer. And do you know why? Because its warning signs are often so quiet, so subtle, that by the time they're taken seriously, the cancer has already spread. Unlike other cancers, pancreatic cancer rarely shows up in a way you'd expect. No dramatic pain, no obvious mass, just everyday changes that sneak into your life until it's too late. In this video, we're revealing 9 silent symptoms of pancreatic cancer that are often overlooked. Some seem harmless. Others mimic common issues like indigestion or fatigue. But together, they could be your body's desperate call for help. Watch until the end. Symptom number 5 is ignored by nearly everyone, yet it could be your only chance to catch this cancer early. Subscribe and turn on the bell so you don't miss life-saving videos. Pancreatic cancer is one of the deadliest cancers because it often develops silently. It begins in the pancreas, an organ responsible for producing insulin and digestive enzymes. Early symptoms are subtle, like fatigue, unexplained weight loss, nausea, or changes in stool. Many people ignore these signs until the disease has already spread. Jaundice, new-onset diabetes, and abdominal pain that radiates to the back are also common red flags. Because early detection is rare, knowing the warning signs can make a life-saving difference. Always seek medical help if symptoms persist or worsen. 1. Unexplained weight loss. Are you losing weight without trying? No changes in diet, no increase in exercise, just the numbers dropping on the scale? That could be a red flag. Unintentional weight loss is one of the earliest signs of pancreatic cancer. When the pancreas begins to malfunction, it affects the way your body breaks down food, especially fats. This leads to poor nutrient absorption, even if you're eating regularly. You might also lose your appetite or feel full faster than usual. It's not just eating less. It's your body failing to process what you eat. If you drop more than 5% of your body weight in a few months without reason, it's time to speak to a doctor. Sudden weight loss can be a warning of cancer, including pancreatic. 2. Abdominal pain that radiates to the back. Pancreatic cancer often causes discomfort in the upper abdomen, right around the stomach area, that can spread to the back. Many people describe it as a dull ache or pressure that comes and goes. At first, it might feel like indigestion or even a pulled muscle. But this pain is different. It often worsens after eating or when lying down and may ease slightly when leaning forward. What causes it? As the tumor grows, it presses on nearby nerves and organs, creating referred pain. If you've had persistent upper abdominal or mid-back pain for more than a few weeks, and it doesn't respond to regular treatment, don't ignore it. This could be more than just gas or a strain. 3. Yellowing of the skin and eyes. Jaundice. Jaundice is one of the more visible symptoms of pancreatic cancer, and it often appears before any pain is felt. The yellowing of the skin and whites of the eyes happens when a tumor blocks the bile duct, causing bile to build up in the body. It's not just about skin color. You may also notice dark urine, pale stools, or itchy skin. This is a major red flag that your liver and pancreas are not draining properly. Jaundice linked to pancreatic cancer often comes suddenly and without other liver symptoms. If you or someone you know develops these signs, especially without other causes like hepatitis, get medical attention immediately. 4. Loss of appetite and digestive problems. If food doesn't sound appealing anymore, or you feel nauseous or bloated after eating small amounts, it could be more than just a stomach bug. The pancreas plays a crucial role in producing enzymes that help digest food. When it's affected by cancer, digestion slows down or becomes inefficient. This leads to bloating, indigestion, gas, and an early feeling of fullness. You may feel like food just sits in your stomach, or that you're hungry, but can't eat. These symptoms are easy to brush off as diet-related or temporary, but when they persist, especially along with fatigue or weight loss, they need investigation. 5. New-onset diabetes or worsening blood sugar control. This is one of the most overlooked warning signs, yet it's critical. The pancreas is responsible for insulin production. When cancer disrupts this process, blood sugar levels can become unstable. That means people with no history of diabetes may suddenly develop high blood sugar or even full-blown diabetes. For those already diabetic, their blood sugar may become harder to manage. If you've been recently diagnosed with diabetes, especially after age 50, with no obvious risk factors like obesity or family history, your doctor should consider screening for pancreatic issues. This type of diabetes is often called secondary diabetes, and it can be a crucial early clue. 6. Changes in stool, greasy or light-colored. The way your stool looks can tell you a lot about your pancreas. Pancreatic cancer often affects the release of digestive enzymes, which are essential for breaking down fat. When these enzymes aren't reaching the intestines, your stool may become greasy, float, and have a foul smell. This is called steatorrhea. You might also notice clay-colored or pale stools if the bile ducts are blocked. These changes may occur gradually, but they're consistent and visible. If your bowel movements have been looking different for weeks, especially if accompanied by bloating or cramping, this could point to pancreatic problems, including cancer. 7. Blood clots, especially in the legs. This might surprise you, but blood clots can be an early sign of pancreatic cancer. Some patients develop deep vein thrombosis, DVT, a clot in the leg, before they even know they have cancer. The leg may swell, feel warm, or become red and painful. Why? Pancreatic cancer, like many cancers, increases substances in the blood that promote clotting. Unfortunately, clots can lead to serious complications like pulmonary embolism if they travel to the lungs. If you've had a blood clot without an obvious reason, like surgery or injury, your doctor should consider screening for an underlying malignancy. It could be a silent message from your pancreas. 8. Fatigue that doesn't go away. Persistent, unexplained fatigue is one of the most common and most ignored symptoms of cancer. Pancreatic cancer causes this through multiple pathways. It reduces nutrient absorption, increases inflammation, and triggers immune responses that drain your energy. You might feel like no matter how much you rest, you're always tired. Even simple tasks like walking or working can feel exhausting. This isn't end-of-the-day tired, it's a whole body heaviness that doesn't lift. If you've been feeling unusually drained for weeks or months and can't find a reason, no changes in sleep, diet, or stress, don't ignore it. Chronic fatigue may be the only symptom your body gives you in early pancreatic cancer. 9. Nausea and vomiting, especially after eating fatty meals. The pancreas helps digest fats. When it's impaired by a tumor, rich or fatty meals become difficult to process. This often results in nausea, vomiting, and a feeling of fullness that comes quickly. People may start avoiding food altogether, not because they're not hungry, but because it makes them feel sick. This can snowball into weight loss and malnutrition. While nausea has many causes, persistent nausea after eating, especially when paired with other symptoms like upper belly pain, greasy stool, or loss of appetite, could indicate a serious problem in the digestive tract, particularly the pancreas. Pancreatic cancer is one of the most aggressive and deadly cancers, not because it's the most powerful, but because it's the most silent. The symptoms are quiet, scattered, and easy to mistake for something else. That's why awareness is your best defense. If you or someone you love is experiencing 2 or more of these signs, especially if they appear together or worsen over time, don't delay. Ask your doctor for pancreatic screening, such as blood tests, imaging, like CT or MRI, or endoscopic exams. The earlier pancreatic cancer is detected, the better the chances of survival. But once it spreads, it becomes incredibly hard to treat. That's why this video matters. Don't just keep this knowledge to yourself, share it with your family, friends, and loved ones. It could save a life. For more life-saving health tips, subscribe to the channel, leave your like, and activate the notification bell. Your body talks, your skin, your appetite, your energy levels, they all send messages. Learn to listen, and you might catch something early enough to fight back. Stay safe, stay aware, and we'll see you in the next video.